Welcome back to True Vine Talks with Lindn Rachel. We have a very special guest here today, and her name is Mahija Kottapalli.
Yes.
Am I saying it right?
Yep.
And Dr. Kottapalli and I worked together at a previous location, and she is so warm and so caring.
Oh, thank you.
And very listens to her clients, and I've just really appreciated the opportunity to work with her. So Rachel and I are going to, kind of ask her some questions that, our listeners might have about medicine and mental illness today. So Rachel, you want me to start?
Yes, please.
Cool. So Dr. Kottapalli,
Mm-hmm.
what made you passionate about mental health?
Well, it's a lot of reasons, but I think the main reason, I was thinking about that, the main reason is I have a daughter that's 23 years old. She has autism, and when she was first diagnosed, I was done with medical school. My husband was already, working, but we felt like we didn't know much about it. We knew it was a devastating diagnosis. However, as far as treating it, we didn't know anything. There weren't any resources, no medications. There was conflicting information about everything. It was a puzzle, as it is depicted in most logos and everything. So I felt like becoming a psychiatrist would help me gain more knowledge and perhaps help ourselves and help my daughter get more treatments or therapies or whatever that she would need. So I think that was the main reason. I mean, there's other reasons too, obviously, but I think that was the main reason.
Oh, so she, out of an attachment frame,
Yeah.
she wanted to help her baby.
Well, I mean, mostly ourselves, because we felt like, this, what do we do? How do we do this? Who do we talk to? Who do we contact? How do we go about this? So, I mean, that was 20 years ago. I mean, a lot has happened, as far as developments and new therapies and everything. But I think that kind of drove us into, let me do this and see what I can learn about this.
Yeah.
But nothing has changed really over the years as far as treatments for autism and, getting closer to finding a cure or anything, But
What medications sort of reduce the symptoms?
Well, I mean, there's no specific medications that are, geared towards autism. There are a couple of medications that are FDA approved for agitation and aggression in autism. But however, as far as the core problems in autism, those medications do not, affect at all. So really, it's mostly a symptomatic treatment. If a child with autism is hyperactive or is having focus problems, then we treat with ADHD medications. If they seem to be anxious, then we try to treat with anti-anxiety medications. So it's mostly symptomatic, but as far as the core deficits with autism, there's no medication that can treat or cure that.
Oh, wow, that's helpful.
Yeah, very.
Yeah. So what did you find helpful when you guys were on your journey and your search to help your daughter?
Behavioral therapies, but very intense. Applied behavioral analysis, ABA therapy, was the most helpful. I mean, she changed from a non-verbal child to somebody who can talk, convey her needs. She could take care of herself. I mean, I can leave her home for a few hours and not necessarily need, worry about it. So I I would say that ABA has helped in that way. I mean, she's not recovered, she's not cured, however, she's better functioning than she was several years ago. So I would have to say ABA has, I mean, it was intensive, 30 to 40 hours a week of repetitive teaching tasks to her. It's very intense, and fortunately we have a couple of schools in the area and several ABA certified behavioralists in the area, so I'm glad that that's happening. But at that 20 years ago, we had to fly in consultants from New York, New Jersey to help us teach those, methods. But now we have our own local, behavioralists in the area. So that it has progressed in that way, and there are several insurance companies paying for it, whereas at that point we were paying out of pocket for all the therapies. But now insurance companies are paying, so we've made progress in that sense. So that's encouraging.
Mm-hmm.
Very,
Yeah. So if our listeners, have someone close to them or someone in their family that's struggling with autism, ABA therapy is what we would want them to pursue.
Mm-hmm.
Yeah.
Yep.
Very helpful. You want me to
keep going with the questions.
All right. So, what's a common myth? About psychotropic drugs.
Common myth I hear from patients is that if I get on a medication, I will have to stay on it forever. So that is a myth, because it's with proper monitoring, we can get them off the medications, and it's not a given that once you get on medication for depression or anxiety that they would have to stay on it. I see all the time where patients are able to get off of antidepressants and anxiety medications. However, there are some diagnoses like bipolar disorder or schizophrenia. They're lifelong illnesses, so it is natural that they have to be on medications lifelong, because it is a chronic and lifelong illness. But as far as mild to moderate depression and anxiety, just because you're on for maybe 3 or 4 months doesn't mean that you will end up having to stay on them for life.
Yeah.
So that is a common myth.
Yeah.
There's no other I can
Yeah.
think of.
Yeah. That's pretty much the one
Yeah.
that most people will say, "Oh, I'm gonna be on this forever."
Yeah. It is a concern for a lot of people.
It is.
They don't want to feel like they have to rely on medication every day for the rest of their life to
Right.
have average functioning.
Yeah. So, what are some common reasons why someone would want to see a psychiatrist?
Well, in this area, it's mostly anxiety and depression, and ADHD. Honestly, a lot of adults and kids, focus problems and attention problems. So those would be the most common ones, and then a lot of those patients who have anxiety and depression may end up getting a diagnosis of bipolar disorder over time, but their presenting problem is mostly anxiety or depression.
Yeah.
Yep.
And so, when someone starts to struggle with sadness, should they try to seek medication management right away, or should they?
No, I would say that they probably should seek counseling or therapy first, and then it could be something that the therapist and the patient mutually can decide, if it's to a level or to an intensity where medications are needed. So mild to moderate depression and anxiety don't need medications. They can be addressed with counseling.
Yeah.
However, I do understand working patients, they may not have the time to go see a therapist on a weekly basis, or be able to, you know, pay the copay or the insurance, you know,
Yeah.
to kind of pay on a weekly basis. So they may want to seek medication treatment, you know, earlier on.
Yeah.
But I would think that if they have the means and the time, that counseling, talk therapy would probably be the first line of
Yeah.
treatment before they consider medications. But having said that, you know, medications are not that bad, you know, and it's still a taboo being on psychotropic medications.
Oh yeah.
But, you know, what I want to tell patients is that there are more people on psychotropic medications than they know, you know, around them. They
Yeah.
just don't know about it.
Mhm.
But there are a lot more people on it, and it's common.
Very
It has become a
common.
common trend now, you know, just as common as blood pressure medications or something like that. So there, and that's probably because antidepressants and medications that treat anxiety are safer now than, you know, the newer ones are safer than they were 30-40 years ago. So you know, even primary care doctors are more comfortable prescribing these medications now than ever.
Yeah. Well, that just brought up a question for me. Like, so when 20, 30 years ago, is it because they were just new on the horizon that they didn't know if they were safe, or?
Well, I mean, the evolution of medications is that, you know, you usually have medications and they have side effects, but drug companies, you know, tend to, you know, come up with newer medications with lesser side effects than the older ones. You know,
Gotcha.
otherwise, why would they have a market, right? So the drugs evolve, you know. So the newer ones typically have lesser side effects than the older ones. So 40-50 years ago, that's all they could come up with, you know, some,
Yeah.
you know, tricyclic antidepressants, MOI inhibitors, and they had huge side effects, you know, on the heart and, you know, other systems, and they were toxic in smaller doses. You know, even if you took 3 or 4 pills, they were toxic and, you know, resulted in deaths, like overdoses. But with SSRIs, you can take a whole bottle. I mean, I'm not saying they're safe, you know, and I'm not suggesting that it's okay to do that. However, you know, they're not fatal to the point that you would die, you know. You may have untoward effects, and, you know, you may end up in the ER and stay in the hospital, you know, with some unwanted side effects, but they will not kill you. I mean,
Yeah.
disclaimer.
Yeah. Yes, of course. Yeah.
Like some of the tricyclics, you know, with just a few extra doses, you know, they were toxic on your heart.
I see.
You know, arrhythmias and, you know, and other side effects.
Yeah. So we've come a long way.
Yep. Mm-hmm.
As far as like side effects and not being too toxic for your body. That's
Right.
good. So how do you think the psychotropic drugs help with the anxiety and the depression?
That is something that is still unclear.
Interesting.
There are several theories as to how they help. Chemically, we know that, you know, like the medications like Prozac, Paxil, Zoloft, they're called SSRIs, short for selective serotonin reuptake inhibitors. So we know that they block absorption or reuptake of serotonin. So therefore, at any given time, the amount of serotonin between the cells is higher, and therefore there is an improvement in mood, not immediate, but in a few days, in a few weeks. However, we don't know how that elevates somebody's mood.
Interesting.
So there are theories, but nothing has been proved yet. So everything is still unclear as to why. But at the same time, we don't know why somebody gets depressed. So because we don't know the etiology, we also don't know how these medications work. Schizophrenia, there are only theories as to their etiology. But then again, we don't know for sure. A lot of times genetics play an important role because all these depression, anxiety, schizophrenia, bipolar disorder run in families. So we know genetics play an important role. And we know trauma plays an important role, environment, stress, and trauma. So it's a multifactorial etiology. Nothing, one particular cause has been found. So we're still in the research
fascinating.
phase. Yeah. And similarly with medications, we don't know clearly how they work. We know, this is what the chemical changes that take place, but there hasn't been able to connect those chemical changes to consistently to mood elevation or depression. So if somebody's blood, there's no way to check in the blood if there is a chemical imbalance, so is there serotonin low? We don't know. Now, it's not consistently low. However, elevating their serotonin does help with the mood. And the same way with dopamine and other neurotransmitters. Elevating those by giving these medications helps improve their mood. But when they checked blood levels, not necessarily everybody had low dopamine or low serotonin or low norepinephrine. And again, you can only test their body blood, but not their brain blood.
Right.
So the levels of these neurotransmitters in brain versus in the body could be different.
Wow. They definitely don't advertise that.
No. No.
Yeah. That's fascinating.
For the listeners, since we're talking about serotonin and dopamine, could you just briefly explain what those are and why they're important when talking about depression?
They are neurotransmitters, which is, fancy word for neurochemicals. I wouldn't call them hormones, but they are chemicals that are released between cells, from cell to cell in the synapse, all that. I'm not going to go more into all that detail, but what they, again, it is, what they do is very, a huge list of things. However, in relation to mental disorders, we don't know everything yet. For example, serotonin is also involved in digestion. Serotonin is, secreted a lot, in the small intestine, and it helps with so we don't know how that relates to mood, in the brain though. I think it's certain parts of the brain where it mostly helps with chemical messenger systems and all that stuff, how emotions are processed in the brain. But then again, we don't know the exact details about how they work and everything. But we do know that, dopamine is associated with wakefulness, pleasure, and similar components in the brain. Now, the serotonin is mostly associated with emotional processing, and which is why it helps with mood, I think. Okay. So dopamine, there are some medications like Wellbutrin and Adderall. They increase dopamine as well as norepinephrine. And so they're kind of associated with wakefulness, motivation, energy, and interest, having an interest, and pleasure in life. So increasing their level in the body, in the brain, is associated with those, the pleasure, the interest, and having more motivation and all. So that's how we're able to, give these medications and treat some of those symptoms. But we really don't know if somebody's dopamine is low or serotonin is low or anything like that.
Wow, thank you so much for sharing all of that, because I don't know about you, Linda, but I'm sitting here thinking, wow, this stuff that I have read is either I've misinterpreted it or it's misleading. about serotonin and dopamine.
Yeah.
I always thought like, oh, those are the happy hormones. And here you are saying like, oh, I wouldn't really call it a hormone. It's a chemical. So very interesting. Yeah. Thank you.
Yeah, the dopamine is a motivation. Yeah, and serotonin is that is the emotion driven. Yeah. Interesting. So when you have a close bond with someone, you probably get an automatic release of serotonin when you feel warm with someone or comfortable and safe.
I mean, these are all theories. We don't know unless we check at that time. So I don't know that the studies have conclusively said that that's what's happening. But I think with some of the, with dopamine, we know that, after you eat a good meal or, after sex or after you go shopping and buy something, the pleasure associated with those is, there's definitely an increase in dopamine, at that time. But it's less clear with serotonin, how that works. But all we know is that when serotonin is increased in the presynaptic, between the cells, eventually there is an improvement in mood, and therefore we continue prescribing those medications.
Yeah. If you see your client improve when you prescribe that, then that is your indicator that this is working.
Right.
Yeah.
Right. So that's all the studies have shown, that we give these medications, there's improvement in mood, and therefore we these are helpful.
Yeah.
But but that doesn't mean that the cause of these problems is because there's not enough of serotonin or norepinephrine or anything like that. So, I mean, to some extent what you've read, or what it is true, it is considered, to help, improve your mood, that kind of make you happy. However, what we're saying is that there's not enough evidence to say that these people are deficient in these chemicals. However, the chemical imbalance, theory, it's a convenient and oversimplified way to explain things. And it's very convenient to tell patients, you're depressed because, you have a chemical imbalance. But, it's not as simple as that. There's a lot of factors involved, like we said, the genetics, the stress, trauma, environment, a lot of things play in here. So it's not just a chemical imbalance, though. But it is easier to explain to patients, to say you have a chemical imbalance and we're going to make that imbalance go away by these medications, and therefore, But what's important, more so than the etiology, that these medications, whether they're safe or not, and are they helping or not, So that's pretty much in practice, though, that's what we focus on mostly.
Right.
But when it comes to etiology, we don't have all the answers.
Yeah.
Well, mental health is complex.
Right.
Very complex.
What we gotta learn next? I'm loving it.
I know. Yeah, I've never had it quite explained so well before. No one's ever explained it like that to me. Yeah. Thank you. So is there natural methods leading into what we're talking about to help with, the symptoms of anxiety, depression, bipolar, because a lot of what Rachel and I do is teaching, clients to sort of take some self-care into account for, rising the same time of the day, exercising, diet,
breathing right, and I think they all play a very important role, and they all those need to be attempted first before medications, honestly. So having a healthy lifestyle, good diet, sleeping habits, maintaining sleep hygiene, and exercising, because we know that exercise releases some neurohormones, neurotransmitters, I'm not sure what, I don't remember exactly. I think they release opiates, maybe even
painkillers?
dopamine.
Natural painkillers.
Well,
Natural painkillers, guys.
Yeah, which are associated with the feeling of well-being. So,
Yeah.
so I think all those natural, processes have to be considered first before even touching medications.
Yeah. What do you do when, your patients aren't practicing those type of lifestyle changes when they come see
We
you?
can only advise and encourage them.
Yeah.
But we can't, we have to rely on what they're telling us. But, when somebody comes to us saying we need medication, we think we're at a stage where we need medication, we kind of assume that they've tried everything else.
Yeah.
But we also advise, have you tried this? Have you tried that?
Yeah.
But, with mental health, there is a lot of taboo. And when somebody, we kind of, our default position is that, when somebody is motivated enough to come to a psychiatrist and have, gone through the barriers of the taboo and, worrying about being on medications,
Mm-hmm.
they have already, thought about all that before coming to a psychiatrist and saying, hey, I think I'm at a stage where I need medications. So, we...
That's so true.
Mhm.
Yeah. It is the last.
I mean, there are a
Yeah.
few times when really young kids are brought to us and say, and then I discourage them from, putting their kids on medications because they're too young. 3-year-olds, 4-year-olds, or even 5-year-olds with, ADHD symptoms, we discourage, unless there is ample evidence and third party, information that this is an out of control child. And the same thing, the youngest child with bipolar, that I suspected having bipolar disorder was a 4-year-old. But even then, we encourage behavioral modification, maybe milder medications that are short acting that could help with maybe sleep and some of the behaviors. But we generally tend not to start them on the hardcore medications like mood stabilizers, right away. We wait and at least and try other for lack of a better word, invasive methods, like behavioral modification.
Because the
before
brain's
Brain's
still
still-
developing.
That's what I'm thinking.
Oh,
Yeah.
yeah. Because the brain hasn't went through all those transitions. Yeah. Yeah.
Very interesting.
Yeah, very much so. So what do you find most rewarding in helping people with this stuff? Their stuff that comes up and they can't.
Well, I mean, like with any other profession in the medical field, it's just helping others, making a difference in others' life,
Mm-hmm.
and having a purpose, that is itself is rewarding. I mean, being a doctor, whether it's mental health or any other type of doctor, it's a noble profession, and you are helping somebody, and of course there's other rewards too. You have a sense of I'm important.
I'm needed.
Yes.
Yeah.
You're needed. Yes.
Yeah. So, but basically, it's helping others and finding that you made a difference in their life is rewarding.
Mm-hmm.
I mean, it comes down to that, I guess.
Yeah, it's all good stuff. It feels good to help others feel better about their life.
Right.
Yeah. What suggestions or recommendations do you have for our listeners if they're listening right now, or they're not listening right now, of course, but like with anxiety or depression, what would you recommend they do if they're struggling with those things?
Well, I mean, they're not alone. A lot of people are going through the same thing. I think that itself, knowing that they're not alone will be helpful. And, like I said earlier, they probably don't know that a lot more people around them are, seeking help, whether it's counseling or medications or whatnot. So, they should not feel inhibited, in coming forward seeking help.
Yeah.
But I mean, they could always start out with counseling because the medications are not involved. You can see what kind of help they can get with the counseling, and then if that is not enough, then they can get some more advice, whether they need to be on medication or not.
Yeah. So start out with counseling. Talk with your counselor about, what you have tried to feel better. And then if, talk therapy, which we do, the emotionally focused therapy, doesn't improve your symptoms, then they should reach out to their general practitioner
Practitioners, yeah.
Yeah. So it's
Or even nurses, pastors, preachers. They can. I think if they talk more about it, they will find that a lot more people around them are dealing with the same problems and are on medication or are already seeking counseling. I think that's what I notice for the most part.
Yeah.
They just don't want to talk about it, or reveal anything to anybody because they feel like they will be ostracized or castigated, or like, oh, you have anxiety, depression. Nobody's perfect.
When really half the office that they work at is experiencing the same thing.
Exactly.
Yeah.
That's what I'm trying to say.
Yeah. You won't go through life unscathed with some type of trauma, grief about a depression or some anxiety. No human does.
No.
I've not really met one.
No.
Yeah. So.
Now, have you ever felt like you needed a counselor?
Yeah, of course.
Yeah.
Yeah.
And I felt
love
like
counseling.
I needed a counselor, or
Yeah.
maybe I should go to see a psychiatrist.
Absolutely. Yeah.
We all could use some help one time or the other. So
Definitely.
Yeah, absolutely.
Yeah. There's no stigma in seeking out help for the symptoms that you're suffering from. And, if you're listening right now, don't feel shame that you're struggling, with sad or fear or irrational thoughts, intrusive thoughts. Those things come up. And if you've exhausted many avenues, then you should seek out somebody to talk to, or you should tell your primary physician, hey, I work out, I eat right, and I'm still battling some of these things, and what can I do to get some extra help here?
Yeah, and then it could be that you may need some help, whether it's a counselor or a medication, just for a few months until your coping skills are better. And then you can go off those medications.
Yeah. Let's get the stigma out the door with mental health. Because your mental health, if it's not good, your physical health will eventually decline.
And if you do end up having to take a medication for an extended length of time, that's okay too, if it helps you.
Yep.
Yeah, you want to have your best life. That's the whole saying now. Well, if you can't have your best life if you don't feel like doing anything that matters to you, or that you care about. If you don't even get out of bed and go see your friends, then you're not having your best life.
Yeah, if you're isolated and withdrawn.
Yeah.
You're surviving but not thriving.
Right.
Yeah. But that's our goal at TrueVine, is to help people thrive and grow and feel good. And so we just really appreciate you giving us your time today.
Oh, thank you for having me.
Yeah, and it's just so much valuable information that I didn't know.
Exactly. Yeah. I learned a lot
Yeah.
in this short amount of time.
Yeah.
Thank you.
So our listeners are going to really appreciate you giving your time.
I'm giving information that I have learned and over the years, and hopefully that is still the case. Unless there are some new advances in psychiatry that I haven't been in touch recently with, but I think for the most part it's accurate.
Yeah. Well, what would you like to leave with our listeners as you depart today? Anything? Just
not really.
Just pursue your mental health, right?
Mm-hmm.
Yeah. Okay. Well, thank you for joining us today with Truvine Talks with Lindn Rachel and Dr. Kottapalli today.
Thank
Bye.
you. Thank you for having me.